everybody, and welcome to our Health and Social Care Tech cluster discussion. So we want to talk about how it's time to think differently about health and social care. I'm Hamina Ely. I work for Dynamo Northeast I'm just going to, hold on. I'll be in charge of all the slides as well while I'm speaking. So yeah, if everyone just says next slide, that'd be great. If I can sort it out for myself, it'd be even better. I run the Health and Social Care Tech Cluster for Dynamo Northeast and with the Innovation Super Network, sponsored by CGI. And we're looking at everything across health and social care, which of course is a huge area. And let me see if I can I've got really kindly joined today by Alison Toombs from North Tyneside Council and ADAS, Jason Leggett and Justin Ewing. I'm sure they'll do their own intros when we get round to them. And I just want to really briefly, as a first intro, just talk about health across our northern region and just mention what is happening with the ICS for those that aren't familiar with it. So all the NHS trusts are looking across the whole Northeast and Cumbria region, and they collaborate already, but the ICS system is what's happening to bring together local authorities, primary care, so your doctors, your dentists, your opticians, your social services, physios, everything right up to surgery level, in terms of sharing records, sharing data, sharing that patient journey through the systems. And so that's obviously providing a huge challenge to the health service and local authorities and major stakeholders to collaborate in ways that haven't happened before across obviously digital transformation, but also how do you interact with patients, how do you interact with people and communities in all parts of society. And I just wanted to mention that obviously the Northeast is at the top of some of the best and worst lists you want to be at the top of. So we have great health, we have great strengths in research, amazing things happening in data, Centre for Ageing. And at the same time, we have huge health inequality, some of the worst life expectancy and housing deprivation, education outcomes, unemployment. So, this isn't a challenge that the NHS can deal with alone. And neither can local authorities. So we are looking to industry partners, large and small. We are looking, across the board at stakeholders and how we address these huge challenges for the future. So without further ado, because we've got a lot to get through, I'll introduce you to Alison Toombs, who is going to sort of talk to us about what she's up to in adult social care. Thank you.
Thanks, Amina. I have to put my glasses on for this. So my name is Alison Toombs. I'm Assistant Director in Adult Social Care in North Tyneside Council, and I also chair the regional network for ADAS, which is the Association of Directors of Adult Social Care, the Northeast branch on technology. And I also chair the national network for ADAS, as well as I'm the technology lead for ADAS nationally. Having said that, I'm not a particularly techie person, but I have a massive interest in it, and I think it's got huge potential for the future. I'm delighted to be here to speak to you today, and I just wanted to give a bit of a focus in terms of technology and social care and what's happening. So in terms of the network, we set the network up last year. It's made up of representatives of all of the local authorities from the Northeast. And we've also got links with the ICS that Hermione just mentioned, and also NHS transformation. So we are working together to try and look at how we tackle the issue of technology within social care, and also looking across our health partners in relation to health aspects as well, and where we can join up, we do, and where we can work together, we do. So we're really focusing on what technology is available out there for people that can support people in social care. And we're also trying to understand data and intelligence and how we can use this to make good decisions. The main aim of this is to share our learning, to share good practice, and to improve consistency of our work, and ultimately to improve outcomes for people who access support, either through social care or through health. Next slide, please. In terms of social care, it's underpinned by the Care Act. And this has a particular focus in relation to people's well-being, but more specifically, it looks at the domains where people have support needs, and it might be due to a disability, illness, or frailty. And these include meeting people's personal care, so things like getting up and dressed and washed, accessing food, things like shopping and cooking, managing your home, engaging with your community, accessing employment or volunteering, maintaining relationships, and caring for children. So our challenge is to think through where technology can support with these, And in my view, there's lots of opportunities. Think just off the top of my head, things like internet shopping, apps and reminders, video calls, smart technology to manage heating and lighting remotely, voice-activated devices, online groups. The list is endless, and the technology is expanding the art of the possible always. In social care, the vast majority of people that we support live in their own homes. Traditionally, people have been supported by other people, paid carers, family, friends, informal carers. But we know in adult social care that people are an increasingly finite resource. So if we can harness technology correctly, then we can free up those people to provide higher quality support to the people who need it. We need to make sure that whatever technology is being utilised supports people to remain as independent as possible for as long as possible. Often a piece of kit can be multifunctional, so we might meet a Care Act outcome, which also can bring an element of happiness and fun to a person's life. So for an example, in my own area, we've been using Amazon Alexa type devices to support people with meal and medication prompts, but it also enables people to call family and friends or to listen to music, or my personal favourite, to join in the daily pointless quiz question. We're also piloting a set of devices that can establish someone's usual routine of pattern of behaviour in their home. Then staff are notified if something happens outside of their routine, so that action can be taken. For example, if somebody's suddenly going to the bathroom more frequently overnight, might indicate a UTI, so contact with a GP can resolve an issue quickly without a crisis occurring. So actions and decisions are based on evidence and therefore more likely to be accurate and appropriate for the person, resulting in better outcomes for them. Across social care, we know that on a national basis, the ADAS Spring Survey found that technology is featuring heavily in many areas. So 2/3 of directors are taking positive action to invest in strategies for digital and social care and technology. And the focus of this is to improve people's lives, to be healthier and more independent. And 92% of directors viewed investment in technology either as important or very important. So what have we learned since we've had the network in place? As part of the sharing good practice, we've also shared our pain and our learning along the way. And I've got a few insights in terms of what people have been talking about for the last few months. So staff training is vital to make sure people feel confident in using technology. It's crucial to support people in accessing support and to make sure that they feel confident with it as well. Often, high staff turnover means you need to have an ongoing programme of training. You need to make sure that the governance arrangements are crucial, and you need to understand about storing and sharing of data, who owns it, who stores it, how it's shared. If these are set out from the beginning and clear, then it will prevent issues from occurring once systems are being implemented. Systems need to be sustainable, with planned updates, both soft and hardware, to keep them up to date, and good connectivity is a must, but is often a challenge. Technology in its own right is of no value. It only works if it's integrated to existing services and structures, and is part of people's everyday working practice and people's everyday lives. We know that collaboration and co-production of services with people who will be accessing the services result in better take-up and better buy-in, so it's really important that people are involved in that process. The benefits of using technology have generally found to result in better evidence-based decision-making, seeing the bigger picture of what's happening in a person's life as opposed to a snapshot in time. That leads to accurate information being shared in a timely way, leading to informed decision-making and reducing unplanned or unnecessary support. Improving information to assist with an early diagnosis or better monitoring results in better outcomes for people. We're all part of a wider culture change to embrace technology in our working lives, and in adult social care, we need to be making sure that we're part of that. In terms of the current focus of work that we're looking at, the white paper, which is called People at the Heart of Care, was published late last year, and that's identified £150 million worth of investment in technology and social care. There's lots of strings attached to that, and it all needs to be match funded, so it's not an easy quick fix. But some of the things that money is being looked at and being allocated to, linking with the ICS who are overseeing it and linking with NHS who are kind of managing it, it's focusing on support with digitisation of social care records in CQC registered providers, so places like care homes and domiciliary care agencies. It's also looking at implementing acoustic fall detectors in care homes. The reason these have been identified is because they've been tried and tested and they're known to reduce pressure across the health and social care system. But a further 30% of the money is being used to test out new innovations and come up with better ways of supporting people, and then evidence that they are effective in terms of, again, reducing pressure in the health and social care system. This is being scoped at the moment, and locally we had a meeting last week to start thinking about what we might do in our area around this challenge. We need to be ambitious and forward-thinking in how we apply this, and that's a challenge for us all, and we need to work together to look at what opportunities we have to develop this work. The other aspect of work that we're looking at is charging reform. So in social care, people are charged for their support, and that comes through financial assessments. In social care, there's charging reforms coming in October 23, which is looking at people having a cap on their social care charges. So that will rely on more people who currently don't come through the system being involved, having social care assessments and having financial assessments, and then having a way of tracking people's spend in terms of their social care. And there's a lot of work going on at the moment to look at how technology solutions can support with these changes. So looking at things like transforming these systems that are recording for self-assessment, as well as kind of tracking spend, and then making sure that they're automated so that it's a more useful process. So that's the main focus of the work we've got in adult social care at the moment, and I hope that's been a useful snapshot of where we are at the moment in time. Thank you very much.
Well done. Thank you, Alison. That was brilliant. Thank you. Without further ado, we'll leave questions at the end, if that's all right. We'll move on to Jason, who's going to speak to us a little bit around digital exclusion and a wider education piece on actually what is full fibre as opposed to 5G and other options out there for telecoms. Thank you, Jason.
Thank you. Do you want to go to the first slide, please?
Yeah, sorry.
Just by way of an introduction, my name is Jason Leggett. I'm the Regional Partnership Director for Scotland and the North East for City Fibre. Next slide, please. Who is City Fibre? Well, we're the largest independent fibre platform in the UK. We've been around for about 11 years. We're now fully funded with about 5 billion of investment behind us. Currently rolling out infrastructure builds in 66 cities across the country. And obviously in various other towns and rural areas as well. We are a business that's probably second, I think, next to all of the infrastructure providers in the UK. I think Openreach being the largest. We've recently overtaken Virgin in that place. Our view is that full fibre is for everyone. Next slide, please. It's not something we think as a premium. We don't think people should have to wait for this. We think everyone should have access to full fibre now. So hence our kind of build program is really aggressive. It's trying to get across the country to deliver 8 million homes in a matter of about 5 years. So that's why we're kind of throwing money at it at the moment, throwing resources, recruiting like mad in the market, deploying, working with huge amounts of people in the supply chain, around 10,000 workers across the UK working with us to roll out the network. We've committed to government to do this. We think we've got a massive opportunity to not only co-invest alongside others like Openreach, Virgin and some of the altnets, but to really transform the UK's digital infrastructure for the future, because this is a fibre optic. It's a very different technology to anything else we've had previously. If we can go to the next slide, please. As I mentioned, I think it's essential for all citizens. One of the things that you saw on the very first slide is a reference to digital inclusion. One thing that's really unique to City Fibre is the way that we build our networks. We build them across our geographic areas in a contiguous build manner. So in other words, we're not building into cherry pick areas of a particular geography that maybe have a higher demographic profile. We build in a way that we blanket cover an area. Just through a quirk of the way we design our networks, we build fibre exchanges, which would be a telephone exchange in old language. And we build these right in the heart of the community. They're built in shipping container size boxes. And we place these amongst the network as we roll out across an area. And what that means fundamentally is as we build out from those fibre exchanges, we're able to light up homes as we literally go past them. And so what that means is very, very early on in any build, we're able to connect a very broad range of homes. What tends to happen is we sign a wayleave agreement with the social housing landlord in the city. So they get preferential treatment in the sense that they're the first to be connected to the network. So from our perspective, it's really important that fibre is available to everyone. So one of the things that we're really trying to do is encourage a broad range of ISPs to come onto the network. And that competition that we're bringing into the marketplace is basically resulting in a vast diversity in offer now from ISPs. Obviously, entry-level prices are as little as £20 and going even further south, as it were. So we're all trying to kind of make it affordable as a technology. If we go to the next slide, please. Why it's important for me to focus on digital inclusion, I think the most recent kind of Good Things Foundation data and the ONS data in the last couple of years really gives us a view that despite everything and things are moving in the right direction, we still have a significant proportion of people in the UK who are not utilising digital infrastructure. And we're really keen as a business, not only as we invest across the country, to make sure that everyone has access to this infrastructure. A lot of the time it's configured around affordability. And actually, when you look at the data, affordability is just one of the factors. We are talking about culture, skills, kind of motivation to utilize digital infrastructure, and a lot of these ultimately are behind whether or not a home or a resident has access to the digital connectivity. And just coming back to what Alison was saying earlier on, it's so vital that every home has this quality fibre connection, because fundamentally, as all our demands on digital connectivity get more and more, and also they become more important in the home, not just for us to watch the latest episode of Game of Thrones or whatever we might watch on Netflix, but fundamentally to run essential services, whether it be health services, whether there be services that are monitoring vital activities in the home, or even just indeed managing the actual resident itself, through heat, light, moisture, etc. in the building itself. Having a really consistent quality digital infrastructure is essential. And that's why we think digital inclusion is an important focus for us as a business. Next slide, please. So what we've recognised, and some of these figures on the left of the screen are really important to note. So if we're building, you saw that 8 million figure we mentioned earlier on, we're building 8 million homes across the country. One of the big challenges for us is recognising what proportion of people are going to be able to connect to our network, but maybe will fundamentally not be able to utilise the network immediately because of some of those digital exclusion items, whether it be affordability, skills, culture, whatever it might be. So we're obviously looking at what that means for us. We recognise that a significant proportion of the social housing footprint in the UK contains a disproportionate number of digitally excluded residents. So we think it's important to work with landlords, with local authorities, and indeed a broader range of partners, hence the conversation today, to really try and encourage these residents to utilise digital infrastructure. Obviously, affordability will always be one of those factors, and we'll work with obviously ISPs out there to do more on that. But we're also looking at how else can we realise connectivity for homes, even when the end resident, for example, is not motivated by that. So how we're doing that, we're working with local authorities and landlords right across the country. We're working with digital health providers and innovative businesses and organisations looking at deploying new types of social or health technology into the home. We're partnering with UK integrated care partnerships around the country, and we're building on existing rationale. So in other words, I mentioned things like boiler management or heat and light management, security with CCTV or door monitoring, those kind of technologies, or even infrastructure like the attendant alerts or alarms that people wear. So the idea that all these different technologies rely on some degree of connectivity. And so we're exploring how we work with partners across the country to roll out this kind of infrastructure and to build out the rationale for more and more people to utilize the infrastructure once it's connected to their home. And we're developing new digital connectivity approaches. So obviously there's a really, because of the cost of living crisis, and people are not necessarily utilising energy in a way that we'd like them to, in the most economic way. There's a big agenda now working with some of the boiler manufacturers and some of the social housing landlords to monitor and manage energy consumption in the home. And clearly there are opportunities to use technology and infrastructure to do that. There's a large rollout in many local authority areas. Pilots have been used for about 5 or 6 years now. What we are starting now to see is local authorities roll out sensor networks at scale. Now, obviously, a lot of these sensor networks where you don't need very high bandwidth data, but what we do need is consistency and a really fast ping rate so they can get that data back to a data center and have it analyzed. So that's something that we're working with and looking to explore. We're working very closely with some businesses in the sector, in the healthcare sector, looking at specifically how we can work with them and partner with them, and to stimulate more demand. And then ultimately, what we are also starting to explore is, well, how else can we encourage the take-up of broadband services where the consumer isn't necessarily the driver behind it? And obviously, what we're looking at is recognising that organisations in the integrated care system will recognise the value of having a broadband connection to the home or to a residence. So there's new types of innovation that are coming through. We referenced it, virtual ISPs there. So in other words, the ability for a non-technical organisation to operate a broadband service, but they don't have to be involved in running the day-to-day ISP, the service, the installation, the maintenance, etc. But what they do get is access to that digital infrastructure, connecting up the resident, and then ultimately being able to better deploy their technology and infrastructure in the home. So those are just in a snapshot, really, of some of the things that we as a business are exploring. And we're really, really pleased to obviously be in today's session, and it's great to be surrounded by people who are working so passionately in this space. And I'm looking forward to hearing more. But thank you for your time.
Thank you so much, Jason. And it's really fascinating, especially the last point about the ISPs and re-evaluating how we get connectivity to people. I'll pass over to Justine Ewing, who is from CGI, that is our cluster sponsor, and she'll do a brilliant roundup of all of this, what they're doing, I'm sure. Thank you, Justine.
Gosh, high expectations, Hermina. Thank you very much for inviting me here. I actually really loved what Alison and Jason were both saying, and I think that I'm going to talk to you about, hopefully we'll bring that together a little bit around some of our thinking. But just before I start, just briefly, CGI, we are a systems integrator. We're a global company headquartered in Canada, working right across the whole of the UK. And every year, around about January to March, we go and we speak to all of our 6,500 clients, and we ask them, what matters to them, what are they focusing on, what are the things that are concerning them, what are they going to be spending their money on, and what do they need from us as their partners. And the slide that you can see in front of you is a very specific question that was asked to our health and care clients around the world, so across the 40 countries that we work in. And I really love this slide. Before I joined CGI, I worked for the health service for a long time in the innovation space, and right all the way back to 2010 or 11, which seems like an age ago, we were talking then about shifting the balance of care into the community. And what this slide shows is that the pandemic has accelerated some of the system thinking about what really needs to be a priority. So you can see in 2019, improving experiences through treatment and guidance and supporting the person at home was the number 2 priority. That jumped up in 2021, I think probably for lots of obvious reasons for those of us that have been in the health space. But you can see that that's consistent. For going into 2023, our clients across the world are saying that this is their number 1 priority. And second to that is the collaboration across boundaries to help that community-based care be as effective as it can be through better interoperability and better integration. 3 is all about doing more. So it's not about cost cutting, it's about doing more with what we've got today and getting best value from that. And probably not unsurprising, seeing that cybersecurity always been in the top 5, but seeing that cybersecurity is lifted a little bit in terms of priority, probably because of what's going on in the world right now, and getting the value from data. And what I will tell you, because I was part of the team that analysed all of the inputs that we got from our clients, these top 5, there's literally 0.7% of a difference between what was the number 1 and number 5 priority. And there's about 30 or 40 priorities all in, but these top 5, there was not very much in it. So what we took from that is that all of our clients, these are all really, really important and at the top of the tree. And I just picked up on the point that Alison was saying, that 92% of the directors that she's been speaking to are talking about investment in technology being important, or very important. So I think this almost supports that. So what's that really done then or what's it doing to our thinking as CGI? So what the next slide shows is, I'm taking an example of a piece of co-produced work that we've done with a client. In fact, it was a health organisation and 2 local authorities working together to consider the art of the possible around a whole system approach to health and care, and particularly, I mean, this was right in the middle of the first lockdown, when we were having issues with lots of people being unavailable for work, and obviously the demand increasing incredibly. And what you can see here is that the home is right at the centre of this diagram, and new system thinking in the client group that we were working with was saying, look, if home is where the heart is, that's where we should start. So health and care provision should start and move out from there. And I think both Alison and Jason have talked really eloquently around the reasons for doing that and the enablement for that. But in this particular piece of work, what we did was we were looking at all of the assets. And what we mean by assets is people, technology and data, and looking at how we could make best use of that. And you can see there's some different colours in the disc. And for those of you that get a weather eye, it's not that different from the New Zealand Canterbury model, but it's very specific to what we've been doing here in the UK. And I'm going to talk to you in a wee bit more detail about that in a second. Going on to the next slide, though, please, Hermina. What we really started to do was think about, well, if home is where we're starting, what needs to happen to enable all of that to come together? And actually, it's not terribly expensive to create a smart home. It's not terribly expensive to connect a smart home. But where the challenges come is around the convergence and really thinking about how you bring all of that together. So the interoperability, the integration, the data that's already there. And in the Northeast, there's such a huge jump because of the care record work that you've been doing, that actually when you start to think about what you could do in a person's home, it becomes quite exciting. So our work is really starting to think about the role that technology plays to enable. So it's not technology for technology's sake, but it is about really focusing on key problems. So right people, seeing the right people at the right time and in the right place, and really picking up what Alison and both Jason were saying about what you can get from the data from a home. So we also run the smart metering network for UK government, and we're the data service provider for that. And I think, this is a little bit controversial, but I genuinely think that if you were to take the data, the energy consumption data that you get from smart metering, combine that with Internet of Things data in terms of movement, wellness, activity, medication adherence, and marry that together, the pattern of living insight that you can get will really support better decision making. It creates the opportunity for intervention before event. It starts really thinking about avoiding those crisis situations that Alison referenced, but it's also about looking at what's already there and how you use what's already there in a slightly different way. And I can talk for hours about this particular slide, but I won't. If anyone's interested, we can talk to you about that later. What the next slide does is, when you've got all of that capability brought together, which obviously requires very strong connectivity, you can then start to think about, well, what's the potential for a new approach to layered care? And again, this is an example of a piece of work. Oh my, there's the DPD man's coming to the door. His timing's really bad. I'll just ignore him. What we've done is we've started to look at how we can redesign the services and use all of the different services, including community, to start thinking about things a little bit differently. But the key thing about all of this is that it is not about the technology, it's about the service, it's about the culture, it's about the people. Technology is only enabling it. But the key thing about all of this is that being very clear and being able to articulate the problem that we're trying to solve. And that's what each of these colours in the disc is trying to do. So I hope that's given you, a very high level, the type of work that we've been doing. But the one thing that I would say, just to kind of close off, I genuinely think, and I said this yesterday when we were talking to the team, I genuinely think the North East are quite ahead in terms of their thinking for the work that I'm doing right across the whole of the UK. Leave it in the shed. He's now at my window, which is really disconcerting. But, I genuinely think that you are ahead. I think there's a great opportunity to be thinking about the smart city, the interplay with health and care. But the biggest single thing is that the citizens need to be on that journey as well. Yeah,
did you want to go and rescue your DPD man and come back to us? Or
no, he's left it outside the window on the windowsill, so God knows what it is. I hope it's diamonds. So yeah, it is all about that collaboration and innovation and making sure that there is a single view of the person, and you guys are already way ahead of that. So we're very excited to be working with some of you on that. So I'll stop there, but yeah, it's very exciting times.
Oh, that's great. Thank you, Justine. So yeah, I've just put a last slide on there. Please get in touch if you would like to be connected to any of these people, find out about further work in our health and social care tech cluster. My email's on there, and we'll have a little time now for some questions. If anyone's got questions for any of the speakers, that would be great. If you want to put them in the chat box, Q&A session. And I'm just having a little look. And yeah, really, the idea of this session was to talk about collaboration, and obviously there is that whole barrier to, seeming barrier to accessing the NHS for smaller businesses in particular. And obviously CGI works with really big corporations and big government departments. And, what opportunities do you see for SMEs, sort of smaller innovators, to sort of get in on the action, if you like, on some of the things and exciting things happening in health and care, Justine?
I think there's a huge opportunity for small and medium-sized companies, actually. I think there's a couple of things. Big companies like ours have got strength and power to do very complicated things well, and give assurance and take risk that perhaps smaller companies don't do. But big companies like ours also can often not necessarily be that agile or that dynamic. So for us, it's really about working with smaller companies, brings that agility and that dynamism, but it also brings cutting edge innovation. Smaller companies are great to collaborate with because they will work with us in the way that we need to work, but we can give them that support and the umbrella to come into the supply chain. It's very difficult quite often for small companies to pass some of the quite high barriers at times to get into the supply chain. So we can help with that. And a big part of what we are doing, and Kieran Lane, who works with me pretty closely and I think is on the call, we're working with companies right across the north of England who've got really great, innovative, transformative ideas. And when you start to look at the smart home, the connected home, the types of devices and the services that are going to need to be provided, this is, being pretty blunt about it, it's a fairly huge pie, and there's enough for everyone to share. But the key thing for me about all of this is that whoever we are working with has got to have the same values as us. You know, for us, it's not about expensive day rates, it's about outcomes. And it's all about partnering and having a bit of skin in the game. So for us, that there's a huge amount of opportunity. And if there are any small companies that are watching or are part of this session today who think they've got something that might be interesting to us, please reach out, because we're really keen to work with those companies with those great ideas. So yeah, I think there's huge opportunity. Circular economy, I think it's called in policy context, but everybody can win out, including the public sector in terms of working with these companies.
Thank you, Justine. And I've kind of got a question for Alison, I think, but it's a more general question as well. Obviously, with the health focus now on more preventative types of monitoring and apps and sort of digital interventions, you know, the NHS has traditionally come from a framework or regulatory system where you're talking about medical devices and medical monitoring, and obviously getting those solutions through a real strict framework to get in to sell to the NHS. However, if we're talking about taking things into the home, I think obviously there are the ways of developing frameworks, and there are new things coming out in terms of how do you actually control what's out there. When, at what point does something become a health app, or at what point does it just stay something that's, you know, bought off the shelf on Amazon? And then actually, who should be funding that? Is it, you know, can the NHS be looking to fund all these things that are more preventative? Because, you know, is the NHS built there to cure, not to prevent? So it's kind of a bit of a vague area, isn't it?
So if I take that from a social care perspective, I think it's probably easier because that's my area rather than the health. I can't really speak for health in terms of their kind of governance arrangements, but, you know, obviously we are working together, but we still are different organisations and we have different protocols. So from a social care perspective, we just in terms of what we've been doing, variety of different people have done different things in different areas. So there's absolutely a focus on using, there are some areas, and it's kind of a mixed economy. Some people are using very specialist kind of things that have been developed for social care or for health, monitoring aspects. But there's also a lot of Internet of Things which you can purchase off the shelf, you can get from your local kind of retail kind of place, that actually, whilst it's available for me and my lifestyle, it will also be available for anybody else. The fact that they've got a disability or they're frail or they need adult social care support doesn't mean that they can't utilise the kind of the things that anybody would use to actually make them more independent, and for them it can have more benefits. So for example, my house is riddled with Alexas, but it means that I can turn the lights on and off, I can turn the TV on and off. I'm not a techie person, my husband is, so that's why it is, just to put it out there. But it's, you know, we can turn the lights on and off. And if somebody has a disability and doesn't have the ability to kind of move around as freely, or can't use, you know, needs voice activation, then those kind of devices are ideal for helping that person to be independent by turning the lights on and off, access, you know, managing the heating, can be, you know, door intercom system, turning the TV on and off, you know, all those kind of things that make my life a bit easier can actually make somebody who has a disability's life empowering. So it's not that it's about it's a different device, it's just it's used in a different way. It's more useful to that person than it is to me, helpful to me, parts of my routine, but actually for somebody like that it can become massively empowering. So I think that's really crucial. So in terms of the funding aspect of it, that's a really interesting one. So we, in my own local area, we have been we're looking at we're purchasing items where it's required. We're supporting people and encouraging people to purchase themselves, but we can loan things to people. We can put in Wi-Fi if somebody doesn't have Wi-Fi to enable them to access it. What we don't want is we don't want cost to be a barrier. So many people will be able to purchase things themselves and be very motivated to do that. Other people, that's a real barrier. So it depends on the circumstances as to whether it can, but it is something that could then become part of their social care plan. And obviously there's then you know, kind of the whole issue around financial assessment and charging, but that service can be part of their plan in the same way as having a visitor come to visit their house, a carer come in and actually provide them with support. that device could be the part of that plan as well. So the cost of that device might be included in the cost of the charge rather than them having to pay up front. So there's a variety of different ways it can be done. And there's a lot of other areas where we're looking at kind of joint things. So Justine mentioned the Great North Care Record. Now that is obviously a specific thing in relation to kind of sharing care records, but that's been done across the North East, across health and social care, and it's really taking on momentum. So, there's ways of sharing information so that people can have access to the right information, enable people to make decisions, share information across health and social care. That's been really innovative and is really far forward. There's a lot more work we can do, and we're obviously kind of building on that all the time, but it's actually been really innovative in terms of taking that forward. So it's been really helpful.
Oh, that's great. And that sort of ties into what Jason was saying as well about finding new values for having connection, so that's why we want to be talking to social housing providers and others, gas networks, electricity networks, all the kinds of people, obviously, that are interested in their most vulnerable customers and how to get them included. So there's a lot of different ways this conversation could really go. So that's hopefully something we'll be exploring in the months to come with the cluster and with working with partners. But I think we're going to actually have to wrap up in a minute. I don't know if Jason had any parting words from City Fibre.
I mean, it's just hugely exciting to see the range of partnerships that are coming together across the country, I have to say. I mean, I think when we saw the dramatic changes that were going through the health and social care sector again and we see it regularly as governments change and policies change and all that kind of stuff. But I genuinely think the collaboration that we've been seeing from my perspective, from a layman's terms, it's really rewarding. So I'm really hoping great things are going to emerge from these partnerships in the months and years to come, and hopefully the role of providers like ourselves can play a part in supporting that and make sure connectivity gets to everyone.
That's great. Thank you so much, everybody. I think that's